The Affordable Care Act, which I had a hand in implementing as head of Medicare and Medicaid, of course, happened in the middle of aligning forces for equality. It was the new game in town. I personally regard the Affordable Care Act as an immense American achievement. We have 20 million people who have coverage that didn't have it before. And the Affordable Care Act gave us a lot of tools for clarifying purpose in healthcare, moving us toward value-based payment, moving us toward transparency, moving us toward quality as a focus. So it's a very good step. But as Aligning Forces for Equality discovered, changing the mindset and the investments of a $3 trillion industry is really hard. I personally think that Aligning Forces for Equality had the right theory, which is this is more likely to happen at the local level than at the national level. The national regulatory and statutory environment, it sets the stage. It's very important how CMS pays for care and so on. But unless the agenda of better health, better care, lower costs, unless that agenda is owned by communities, variously defined, but by relatively self-contained populations who know each other, who have a common stake, it's really hard to get the changes made. And it's hard to make them customized because federal policy is a very blunt tool. And the way we need to work on, say, access to mental health services or risks for children or integrating healthcare with housing, all of which are crucial, that's going to look very different in downtown Boston, in rural Alabama, or in the coast of Oregon. So I trust local initiatives. The work of Eleanor Ostrom, which I became a student of, is really key here. Professor Ostrom was the first woman to win the Nobel Prize in economics ever. And her work was on managing the commons. The commons means the resource that we all have access to, a fishery, a forest, maybe, but that we can all destroy if we each just act in individual self-interest. And until her work, it was taken as inevitable that there was a tragedy of the commons, that everyone would take everything they could get and the commons get destroyed. No more fish, no more forest, no more grass. What Ostrom discovered was that's not true, that there are many communities that have something in common that they manage well. And they do it with a series of sociologic circumstances, rules, habits, structures that actually allow them to act as a cooperative force in their own self-interest. We need that in healthcare. Healthcare uses the commons. It's the commons of the resources we pool in order to get healthcare and that are taken from somewhere else. It's really hard to get that consciousness of what we share at a national level, a nation of 320 or 30 million people. But when you go to a town or a city and you begin to say, we are in this together, what healthcare takes, schools don't get. Your health affects my well-being. We get a chance at acting together, aligning. And that really pushes me much more toward local activity, as AF4Q tried to do.